This is Amy Elder. I am an LPN to BSN student at Indiana State University, and this is a presentation on COVID-19 vaccine. By the end of this presentation, the viewer should be able to define COVID-19 and the vaccines, identify the population impact of herd immunity, identify the most at-risk populations for COVID-19, analyze how COVID-19 vaccine works against the virus, and recognize where to get COVID-19 vaccines. At this point, please stop here and take the pretest to assess your knowledge about COVID-19 vaccines. The pretest can be accessed by clicking the link accompanying this presentation. The coronavirus is a type of SARS virus, and there are many different kinds of these SARS viruses, some of which can cause diseases. COVID-19 is an infectious respiratory disease that is a new type of coronavirus that has not been previously seen in humans. Coronaviruses are named for their appearance, because under a microscope the virus looks like they are covered with pointed structures that surround them like a crown. And there are three main types of COVID-19 vaccines that have been authorized and recommended or are undergoing clinical trials right now in the US. The first one is the mRNA, which is material from the virus that causes COVID-19 to give our cells instructions. And so the vaccine makes a harmless protein for that's unique to this virus to help restrict its access to us. There's a protein subunit, which is the harmless proteins of the virus that cause COVID-19 instead of the entire germ, so your body can recognize that. And then there's also the vector type, which is a modified version of a different virus than the one that causes COVID-19, but it allows our body to create the antibodies and antigens that we need to fight it off. The point of vaccines is to help the population acquire immunity to different diseases. Herd immunity is the goal, and it occurs when most of the population is immune to an infectious disease. Herd immunity is considered achieved at either between 50 to 90% of the population having immunity, and that depends a little bit on a specific virus as to what that actual level is. Currently, if 80% of the population is immune to the coronavirus, 4 out of every 5 people who encounter someone with the disease will not get sick. There are 2 different ways to achieve herd immunity. A large portion of the population either gets infected or gets a protective vaccine. The graphic here kind of shows what it looks like with different percentages of people having been vaccinated and kind of how that distribution looks at infected people versus uninfected people. So now we need to take a look at how a vaccine actually works. So vaccines stimulate the immune system, and there are several tools it uses to fight infections, including immune cells. And those cells are macrophages, which are white blood cells that swallow the dead and dying germ cells, and they leave behind recognizable parts of the germ called antigens. The next one is B lymphocytes, which are defensive white blood cells, and they are the ones that produce the antibodies that then attack the recognized antigens. And then the T lymphocytes attack cells in the body that have already been infected, so they kill and take care of the ones that are currently diseased. All types of vaccines leave the body with a supply of memory cells, and that's how they work to protect future infections from the virus, because your body will recognize those cells when they enter your body again. The COVID-19 vaccine helps the body develop immunity to the virus that causes COVID-19 without actually having to get the illness, so you don't have to suffer through the sickness in order to get the benefit of the vaccine. And it's one of the many steps that can help protect you and the people around you from getting COVID-19. The people who are most at risk for contracting coronavirus need the vaccine are adults of any age with certain underlying medical conditions, and I have a list of those there as well. Some of the key ones are, chronic cancer, kidney disease, any sort of respiratory disease like COPD, heart conditions, people who are immunocompromised, and then things even as common as obesity, type 2 diabetes, and smoking can increase your risk of severe illness from COVID-19. Another population that it tends to be more severe in are people who are older than 60 years old. And then another at-risk group are people who cannot get vaccines and are vulnerable to the disease, including babies and small children, pregnant women, and then immunocompromised people who are not safe to get vaccines. So there's some things to keep in mind when you are getting the vaccine is that it's not an instantaneous immunity that's developed. It does take time, usually a couple of weeks, for the vaccine to help your body create the lymphocytes that are needed to prevent the infection. There can be some other side effects, which are normal because they're signs that your immune system is building the protection that it needs from the virus. Usually at the site of injection, there can be some pain, some redness, and even some swelling. And then in the rest of your body, people tend to experience tiredness, headache, muscle pain, chills, fever, and nausea. And again, these are all typical symptoms that your immune system is working and doing its job and creating the cells that it needs to attack the virus. Many times over-the-counter medication can help with any pain or discomfort experienced after getting the vaccine. These include ibuprofen, acetaminophen, aspirin, or antihistamines. There's still many questions around how to get the vaccine or where to get the vaccine for COVID-19. It's a good place to start is by contacting your state health department for more information about their COVID-19 vaccination plan and to find out either if you are eligible or when you will be eligible to be vaccinated. Another resource is from the CDC. They recommend using vaccinefinder.com. That is a website that has information about the different providers giving vaccines, when they are available, hours of operation, and then instructions on how to take next steps in order to get registered for your vaccine. At this point, please stop here and take the post-test to assess what you have learned about the COVID-19 vaccine. The post-test can be accessed by clicking the link that accompanies this presentation. If you would like to print this handout with information regarding the COVID-19 vaccine and the resources that are available, please use the accompanying link.